Greetings, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Michelle Guadalupe, Director of State Legislative Affairs for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 85 state legislative victories across the country since 2014, including the new law on step therapy in Iowa. But what do these victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their new rights. This includes providing resources like this webinar that explains the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in Iowa that was fully implemented in January 2018 and what to do if you feel the law has been violated. But first, let's define step therapy. It is a protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the Iowa legislature on the step therapy bill. A huge thank you to each of these legislators. Now that there is a law in Iowa on step therapy, we want to make sure you know what that means. The law requires that healthcare providers have access to a convenient override procedure, and insurers must respond to a step therapy exemption request within 5 calendar days for non-urgent situations and with 72 hours for urgent situations. Requests will be granted if a response is not received within this period. Who benefits from this new law? Patients with individual or fully insured group health insurance coverage will benefit from these new protections. The new law does not apply to Medicare, Medicaid fee-for-service, or self-insured plans, which are exempted by the Federal Employee Retirement Income Security Act of 1974. To learn if you are covered, contact your insurer and provide your policy number. A request for an exemption to the step therapy protocol must be promptly approved by the health plan insurer if one of these happens. Number 1, the drug is contraindicated based on the drug manufacturer's prescribing information, an adverse event with previous use, a medical condition, or if the drug is likely to cause an adverse reaction or cause physical or mental harm. Number 2, the drug is expected to be ineffective based on the known clinical characteristics of the patient and healthcare provider's medical judgment based on clinical practice guidelines or peer-reviewed journals. Number 3, the patient's documented experience with the drug regimen. Number 4, the patient is experiencing positive therapeutic outcome on another prescription drug selected by their healthcare provider under their current or previous health plan. What if your prescription is denied? If your medication is denied because of step therapy, your insurance won't cover the prescription. At this point, you may want to talk to your pharmacist and healthcare provider about alternatives that would be covered. You can also decide to pay out of pocket and compare discount cards, cash prices, and assistance programs to determine what would work best for you. This is also the time to begin the appeals process. Make sure to ask your pharmacist what they heard from your insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out on how to appeal the decision. Your physician often needs to intervene and write a letter. Share copies of any insurance letter's information you receive with your doctor and make sure that everyone is on the same page. When you're working with your insurance company, first check with your human resources office to learn specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeal needs to be online or if there's another process from your insurance. Make sure to keep notes of all conversations, who you speak with, dates and times of calls, case reference numbers. Having good records helps move future calls forward. Stay in touch with your doctor through the process and share information. Your insurance company must provide the reason for your denial in writing. Ask about it if you have not received anything. If submitting an appeal yourself, include all relevant documents that help make your case. Letters of support from physician, test results, and your personal narrative. But what do you do if your insurance company is not compliant? You may need to go through an external review process, and this is by contacting the Iowa Insurance Division. But remember, before you can request that external review, you must have completed the internal review process provided by your insurance company and received a final decision. For more information, we do have a website that you can visit. All of our resources will be available on the Arthritis Foundation's advocacy webpage. Thank you for listening to today's webinar, as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections. Thank you.